All right. So the first question is
Hi, everyone. Good morning. Welcome to another session of MA with Dr. Ben. Uh, Happy Tuesday, everyone. And happy early Thanksgiving. Wow. We already have a lot of questions pop. What's
The topic for today is it ever too late to start a hair growth treatment plan?
is it ever too late to start? So the answer is yes, unfortunately. So what happens is that testosterone is one of the main causes why people lose their hair. And what testosterone does is basically it gets converted to DHT, and DHT miniaturizes the hair. Now, there are many different levels of miniaturization, and we see this every day on the magnet when we do a microscope of patient's scalp in our clinic. We see it every day. So there are different many levels. So some hairs are very thick, some hair are kind of thick. So basically, as they miniaturize, they get thinner, and the density of the hair basically decreases. But the key is that it gets thinner and smaller and shrinks and shrinks and shrinks. Now, if it shrinks beyond a past certain point, there's nothing that's going to bring that hair back. The earlier you start with your hair treatment, the more likely you're going to keep it. As simple as that. But unfortunately, I mean, it's actually review like a lot of photos, and patients send the photos with a complete bald, and tell them there's nothing. If you're bald, guys, let's get happy, happy. Okay, guys, let's get started. Somebody this morning called Happy Head Happy Hair. It's a good name. I thought about that initially, when we started it, but Happy Head is better. Okay, how much is your product? Do you have veterans or senior discounts? First of all, great questions. I don't know if you have veterans or senior discounts. That I don't know about. The product is about $79 a month, and the reason why the product is $79 is because it's a premium grade product developed by dermatologists, me, based on a lot of clinical studies, and the ingredients we use are premium medical grade, prescription grade, and honestly, it's actually expensive to put it together. Our product has three prescription grade ingredients all in one, whereas like a lot of other products only have one or two. Also, our product is fully customizable, which means if you use the product, there's any issue with it, we will go back, customize the product for you, make you a new one, and ship you out a new one right away free of charge. Also, the product, since it's a customizable product, we literally make it on a monthly basis and ship that to you. So it's not like a product that's been sitting on a shelf for 2 years. The product is a compounded prescription grade product that is made monthly and shipped out to you. So all of this basically kind of plays into a factor that's what makes it a little more expensive. But again, it's a premium grade product, and I always truly believe that better products will lead to better improvement, just better quality results. Thank you for that question. Tried product a year ago, sticky mess even drying overnight. Can't imagine continuing to use the product if it actually grew. Please, could I have gotten a bad batch? I mean, it's possible. I mean, the reason why it's sticky is because we add aloe vera in order to reduce the irritation from it, but we could remove the aloe vera for you. Remember, it's a customized product, guys. So if it's sticky, let us know. If you don't communicate with us, we don't know what the issue is. So I could remove the aloe vera for you. If it's too drying, we have a special scalp serum that you could apply on top of it, and basically that reduces the dryness. So yeah, and it's possible they just got a bad batch. So we'd love for you to come back. We'd love for you to try it again. Tell us to remove the aloe vera. We'll give you a special scalp serum. Also, you don't necessarily have to leave it on all night. You could just put it on for like an hour or two and wash it out, and you will still get the same results. Again, basically, let's say you get home at 6. You could put it on at 6, take a shower by 8. You don't have to leave it on all night. So that would make it easier for you. John, if there's any questions, you could give us a call or email us specifically, and we'll be more than happy to guide you and customize the product and make it, we want you to be happy. Occasionally, shipments get delayed or even lost. Things happen. That's life. How quickly does a person risk losing their hair growth that they've gained happy from being without any product? So yeah, well, it doesn't happen overnight. I mean, it usually takes about 3 to 6 months. So if you don't use the product for about like 4 to 6 months, you might start losing it, but that might take a while. Um, if you run out of happy, it can minoxidil without any consequences fill in for a few days while waiting for order. Yes, that is not a problem. You could do that. I've had numerous hair transplants 20 plus years ago. I don't like the dermal roller on my scalp because it feels it could potentially tangle and pull some hair out in areas where I am not as dense. Any suggestions for any alternatives? Good question. So instead of using a dermal roller, so what a dermal roller is, I wish I had one here. Um, I'm in the other room, but it's okay. So it's a roller that basically it's a roller that's 540 spikes and it rolls back and forth. But there's something known as a derma stamp. I don't know. We'll get a derma stamp. Actually, I will demonstrate it to you guys. But a derma stamp is a so you're not really rolling. Um, it's a derma stamp. We don't. I know we're giving out the derma rollers for free to patients. We don't have the derma stamp, but maybe we could probably ask. We could probably just get some and put on our website. But what you could just literally stamp it in, so you're not really rolling anything. So there's derma stamp, and there's also some of the other electronic ones over the counter that you roll. Oh, thank you, Evelyn. So this is a derma roller. And it's really helpful for penetration. This is a derma roller. You gently roll back and forth, and you don't have to be too aggressive. Uh, but there's also derma stamp, and you can just buy it on Amazon, like $20. So you kind of stamp it on, and then you apply the liquid on top of it. Thank you for getting that. Again, there's also other electronic ones. There's one brand called Dr. Pen. We're not affiliated with it, but they're called derma pens. So they're electronic derma stamps. You could buy those online. Ever consider adding something like DMSO, which is typically used as a topical paint ornament to the product? DMSO crosses the blood barrier and is absorbed directly into the bloodstream through the skin, so the medication will be absorbed via care like DMSO. This is a great question. I know DMSO very, very well because we sometimes use it in our nail lacquers actually to penetrate the depth of the nail, and sometimes combine it with urea and salicylic acid. Um, we have kind of thought about it. DMSO has some issues basically applying to the scalp. Thank you so much for that recommendation. Again, we use it in the other derm applications. Well, think about it. Thank you so much. When will the oral minoxidil be available? I have a mild to moderate fluctuating hypertension, and the minoxidil will be ideal, and we'll be killing two birds with the same stone. I agree. I think we already have available. Yeah, it's already available. So you could just email us at help@happyhead, or just go on the website on the product section. Oral minoxidil is there. Here is my recommendation for oral minoxidil. Start with a quarter of a tablet for the first 2 weeks, and then go to half a tablet after that. Uh, in my sometimes in my private practice, I might also go to a full tablet. But there was the New York Times article that was published 2 months ago showed that low dose minoxidil does very well. So you really don't need to go above half a tablet. Side effects include dizziness, lightheadedness, chest pain, and shortness of breath, which is very rare, dizziness or lightheadedness. Please watch out for ankle swelling. I have a sufficient head of hair, which I wear med to med, longish in style. It's a little thin in a few areas, but noticeably pretty much to me, I'm very creative. It's difficult to see any hair growth since I have pretty decent hair. So how do you gauge the progress? So you're right. If you have decent thick hair, it's hard to gauge the progress. Here's my recommendation. I mean, if you have really good hair, a lot of these products, Happy Head, Oral Minoxidil, Oral Finasteride, all of these help basically to maintain the hair. And I think it's hard to see the hair density get thicker. So you're right. It's hard to do it. But number one goal is to be proactive about it and maintaining that good thick of hair. I heard long-term use of cortisone, even at 1%, can cause irritation and serious permanent negative effects. I have sensitive skin and remove the retinoic acid from my topical finasteride. But I'm wondering whether cortisone can be removed as well. Yes, it could be removed. So you could just email help@happyhair.com and just say I want to remove the hydrocortisone, and then we're more than happy to remove it for you. Um, by the way, hydrocortisone does not cause irritation. It's actually used to treat irritation. Um, how does age play a role in hair loss? So great question. So obviously, as we get older, uh, our hair is just weakened out. So age does play a major role in hair loss. So I mean, look, someone's hair, if you're in your 20s, come to someone in your 70s, are completely different type of hairs. So age plays a major role. This is why sometimes it's harder to get your hair back when you're older. That's why, again, being proactive about your hair, starting with your hair loss really early is the key to go. Is it ever too late to start a hair growth treatment plan? Unfortunately, yes. If you already lost your hair and there's nothing there to grow, nothing's gonna grow. So the key is, again, I think this is the theme of the day. Be proactive, guys. Start early. Be proactive. I think that's what's really gonna help you the most. If I switch to super capsule, do I still need to take the topical? Great question. So the answer is yes and no. Everyone's different. We know from our own personal experience in our own clinic, patients that are on topical and on oral do much, much, much better. I have patients in my clinic that are on topical happy, which includes finasteride, minoxidil, and retinoic acid, and they're also on the combination of minoxidil with and oral finasteride, and they do really well. Will the super capsule have a higher risk of side effects compared to the topical? Yes, oral medications usually do have a higher risk, but the key is that you don't want to basically start taking a full tablet every day. Our recommendation with the oral super capsule is to probably start twice a week and every week add one extra day, basically, so you are gently and slowly increasing up your dosage so your body doesn't get a shock. When will I see initial shedding from the super capsule? Actually, the oral minoxidil usually does not cause shedding. It's actually pretty rare. Um, a lot of the shedding basically has to do with the topical minoxidil. Sorry, guys, my computer is a little bit slow. Is the advanced is the advanced formula really stronger if it has less concentration of each of the active ingredients? I think you're probably talking about the kitchen sink. Well, the kitchen sink basically has multiple different formulas, and although it's a little bit lower concentration, it could still be a lot more effective just because you have multiple different ingredients in there, and also you're hitting multiple different enzymes. So you're really hitting multiple different causes of hair loss. So the answer is yes, it could still be more effective, although you have a little bit lower concentration of each ingredient. How much is your product? Talk about this again. $79. And again, the reason why it's that price is because this is a customizable product. It's made literally for you on a monthly basis. We could change the ingredients around basically as you wish, and we're always here to support you. I think we give a lot more support than really almost any other company. We truly believe that customer service is the most important thing. So, and also our product has three ingredients as opposed to one. It also has aloe vera added to it and some hydrocortisone. So a lot has gone into making the best product for you guys. Currently, do you guys happen to have an iMac charger? Um, and that's what's the store. I'm currently using Happy Head Kitchen Sink Topical, and I had very good results. Great to hear that. My question is that I have a 3-year-old that sleeps with me at night. I apply the kitchen formula about 2 hours before I go to bed. Should I be concerned that my 3-year-old is exposed to it in my pillow? Technically, if you look at the clinical studies, the only thing we should be concerned about really is it's really, if your wife was pregnant. There's really nothing written about the FDA and exposure to other people in the family. But I have a 4-year-old, so I completely understand the concern. My recommendation is that you could wash the product out before you go to bed. I think that would be the safest thing. And the product is still going to work. So put it on 2 hours before you go to bed. And when you go to bed, basically just wash it out. Then, less things to worry about. We're always a believer that safety comes first. We have a company policy, for example, that we never give this product to females below age 50, whereas other companies do. But we have very strict standards in our company, and thank you so much. And so I say you should wash it out. I think that's the most important thing. Thank you. Can using dermatologist help aid in the hair regrowth process if I'm a little bit older? Yes, absolutely. Dermatologist really helps everyone, and I'm a big, big fan of it. What does the aloe vera do in the base? So minoxidil, um, just by it being minoxidil, is irritating, and also for it to minoxidil to dissolve in a solution, there has to be an alcohol-based solution. So the minoxidil and the alcohol could be slightly irritating. So when we were doing some of the initial trials years ago, this is almost like 4 years ago, we want to reduce some of the irritation, and that's why we added the aloe vera to it. Now, sometimes the aloe vera can make it a little sticky, so if we want, we could take it out. There are other ways that now we have designed to kind of reduce the irritation. So we we now have, like alcohol-free formula, which makes it much lower alcohol. But again, that's what the aloe vera does. What ingredients are in your super capsule? Has there been clinical studies to test efficacy and safety? Great question. Super capsule comprises of three different things. There are three different FDA-approved ingredients that we put all together. One is finasteride that has been around for a long time and many patients are taking it. Finasteride is an FDA-approved medication that is used for hair loss in the U.S. Number two is oral minoxidil. Oral minoxidil is the FDA-approved drug for blood pressure, and it is used for off-label use for hair loss, and we've been doing this for honestly decades. Three is vitamin D, and we know vitamin D basically is good for your hair. The super capsule is a compounded medication. There has been no clinical studies testing the efficacy altogether. However, in our clinical practice, we give patients oral minoxidil, oral finasteride, or oral vitamin all the time, but then they have to take 3 capsules. So what we have done is that basically we have, with our pharmacy, we have a capsule compressor. We take all these drugs, we put it together and put it in a capsule, and it's a compounded drug. So this is allowed by the FDA. But compounded drugs, by definition, don't require any clinical studies and also are not FDA approved. But these are all FDA approved ingredients that we put together. Honestly, it makes the life a lot easier because you're taking one capsule and you're done with it, as opposed to taking 3 different things, and sometimes you may forget or may not forget the different things. So we made this because we want to make it easier for our patients. And with respect to safety and efficacy, people already take all these three all the time together. So we're just trying to simplify the whole process for them. How does one address product build up on scalp without, how does one address the product build up on the scalp without showering all the time? Almost dandruff like shedding. How long does it, so that's a good question. So you're right. The product could cause some irritation and some dryness on the scalp. Uh, that's mainly due to the minoxidil and some of the alcohols in the base. If that's a very common thing, there's 2 things we could do. 3 things. One, you wash the product out after 1 or 2 hours after applying it. 2, there's a special serum that we can send you actually, and it's a serum that you put on your scalp, and it's just very soothing. 3, you could use a leave-in conditioner shower, and that could help. Or 4, we could actually change the product to what's called our water-based formula. And our water-based formula has 80% less alcohol, and it's actually very soothing because it's made with botanicals, and see if that could help you. So you could choose any of those. You could also email and say, hey, I'm going to go on the water-based formula, and we'll be more than happy to do it.
Can you explain the price difference for the water-based and why is that
How much is the water-based formula?
119?
So the water-based formula is a little more expensive. It's 119, and the reason because it's just much more expensive to make. I mean, we actually license out the base from a third-party company, so it's just a much more expensive product to make. For the super capsule, is equivalent to taking 1 milligram of regular oral finasteride? Yes. So the super capsule has 1 milligram oral finasteride, 1.2 milligrams of minoxidil, and 2,000 IUs of vitamin D3. What is the purpose of adding vitamin D in the super capsule? Has having lack of vitamin D been linked to hair loss? Yes. So there's something called the 4 pillars of hair loss, and which means that vitamin D, iron, collagen, and protein. Those are what I call the 4 pillars, and I think those are very important just to have as a baseline for someone to have any hair growth. You need to have those 4 bases covered. I have patients that come in with vitamin D like a 9 level on the lab test, and that's really low. I mean, so you can really do whatever you want, but if you're lacking that vitamin D, your hair is not going to be strong. You're not going to have really good hair growth. So increasing your vitamin D is very important, and I highly encourage everyone to take vitamin D. Obviously, you do want to probably sometimes check your labs to make sure vitamin D is within the normal range. Majority of my patients basically are not, and I think everyone should be taking a multivitamin and a vitamin D. So that's why we have the vitamin D added to the product. So it's finasteride, which is a DHT blocker, minoxidil, which is a vasodilator, and you have vitamin D. Can I only use the medicine once a day? Is it still effective? Ideally, it's twice a day application. A lot of patients use it twice a day for about maybe 6 months, and then they go down to once a day. Um, but look, if you don't have time, you can only use it once a day, then you use it once a day. And as simple as that. Another thing is that if you are going to use it once a day, instead of probably doing like 2 half drops, which is equal to 1 ml, you could do 3 half drops, which is 1.5 ml. So to make up for the fact that only doing it once a day and not twice a day. Do I need to take the highest dose if my hair is only thinning in certain areas? So, I mean, typically, yes. So let's say if you're only thinning in the crown, we still want you to do 2 half drops in the crown twice a day. That's what's going to give you the best results. In the ideal world, doing it twice a day will give you the best results. Is using the product safe if I had a hair transplant? Yes, it is safe. Just don't use it within like 6 weeks after your hair transplant. But after 6 weeks, you should be fine. In fact, we put a lot of our patients after hair transplant in our office on Happy Head, and they see amazing results. How do I know if finasteride or minoxidil will be more effective for me? That's a good question, and there's honestly no way that you're gonna know until you give it a try. Um, I mean, there's some patients that will do finasteride for a few months and then do minoxidil for a few months. I mean, that's not very commonly done. A lot of patients now, a lot of patients basically what they do, they now go on oral minoxidil for about 4 to 6 months. After not seeing improvements, basically they add oral finasteride. Or what a lot of patients do, they start with Happy Head and then they add oral minoxidil on top of it after a few months if they're not seeing the best results. Can I use the product on my receding hairline? Absolutely, yes. Remember, it's going to thicken your receding hairline and thicken right behind it, but the area that has already receded, your widow's peak, is not going to grow back anymore. So that area that you've lost, it will not grow back. The only thing that's going to bring that hair back is with a hair transplant. This is why it's so important, basically, to start early.
Is widow's peak this?
Yeah, exactly. Yes, that's a very good question. So widow's peak is these areas right here. So that's the widow's peaks. And some people are born with really high widow's peaks. I mean, I see patients that they're 14, 15, and their widow's peaks are already that high. And that's normal for them. That is normal. But if you feel that your widow's peak is receding, that means it's getting bigger, then you definitely want to do Happy Head. And what my recommendation would be, do a drop right here behind the hairline and rub it forward, and do another drop right here and basically rub it forward. And that's going to prevent the recession. Is there a difference in how minoxidil and finasteride work? Is it true that it's different for different areas on the scalp? So yes, they're different. So there are many reasons why people lose their hair, and by doing and the reason why Happy Head has multiple different ingredients is we're trying to address the many different causes of hair loss all in one bottle. So finasteride is a testosterone blocker, prevents testosterone from converting to DHT, and DHT is one of the causes of hair loss. Minoxidil is a blood pressure medication that causes vasodilation and increases blood flow to the scalp. By increasing blood flow to the scalp, a couple of things happens. One, it washes out the DHT that's already there. Two, it brings nutrients to the hair, which is great, which is important, like oxygen. And number three, by having an area that's really highly oxygenated on the scalp, it actually reduces DHT production. So studies have shown that if you have a scalp that doesn't have a lot of oxygen, that causes more DHT production. So more oxygen reduces, basically leads to lower DHT. I know last week we were also talking about vegan, being so I'm just gonna touch on that for one more second. So increasing your protein uptake is very important, and also iron levels. So especially in females, if you never eat meat, I mean, you really need to supplement with iron. And the iron, unlike is the whole foods liquid iron, is the 18 milligram iron. Basically, it's just liquid, it's easy, it doesn't cause constipation. Um, and also adding more protein, so eating more chicken, cashews, those are really important. Talking about chicken, so there are many different types of chickens. So there are pasture-raised chickens and things like that. It's very important to do pasture-raised chicken. By definition, what that means is that the chicken is done in a cage. So when you have chicken in a cage, what happens is that it's trapped, so it's running around like a chicken, and testosterone levels go up, and that meat actually has more testosterone in it. So you want to have pasture-raised chicken, add avocados, cashews, nuts to your diet. And also you could supplement more just protein. So there are like whey protein concentrates that you could buy and make a smoothie out of and drink every day. I literally have patients, particularly females, that when they add more protein, like the whey protein concentrate to their diet, they'll come back 3-4 months and they will tell you that their hair feels better, feels thicker, looks healthier, looks shinier. So the protein is important. Is finasteride safe to use in women? Do women have testosterone, DHT in their system? Yes, females have testosterone and DHT as well, of course. Finasteride should not be used in females below age 50. The reason is because finasteride is a category X, and God forbid, we don't want any females to accidentally get pregnant on oral finasteride. This is also why with Happy Head, we do not, with Happy Head, we also do not want females to use finasteride. And also, we don't want you to use finasteride if your partner is planning to get pregnant, is pregnant, or breastfeeding. Well, guys, I thought this was a great session, everyone. Thank you for joining. And again, thanks so much for the entire team and crew here for the help to making this it's live up and running. You guys, next week, right before Thanksgiving. That's right. Okay, guys, have a beautiful day. Enjoy. Thank you so much. Any questions, please feel free to send us an email at help@happyhead. Also, please feel free to give us a review on our Tribe's pilot account. We really appreciate it. Thank you so much.